Hey, welcome to Digless, a podcast by La Quarry for Guernsey. Today we're talking alcohol, and I've got two guests in the studio with me. We've got Andrea Nightingale and Simon Sebire, both from the Health Improvement Commission. Thank you for joining us.
Thank you.
Thank you.
We brought you in based on the back of the Count 14 campaign, which you were doing a lot of publicity about, and I think it's an opportune moment to maybe look back on that and reflect on that, but also look at the data that is driving what you're doing and the evidence out there. I don't know, Simon, if you could start maybe at that point.
Yeah, of course. And we've got a lot of data. And when I say we, I mean kind of Guernsey in general in terms of alcohol. And that mainly comes from public health intelligence surveys that they do, but also things like their mortality report, which tell us the causes of death and disease. And so you can paint quite an interesting picture using all that data. I mean, if you start with the real basics, most people in Guernsey drink alcohol. And so we know that as our starting point. Of those that do drink alcohol, we know that about 35% drink at a level which is harmful to their health. And we know that men are more likely to drink in that way than women are. And especially men in I suppose, early to late adulthood, that kind of middle age really is the kind of biggest consumer, if you like. And we also see that has an impact, of course, on health, disease, mortality, things like that, because the mortality statistics show that the most common causes of death and disease in Guernsey are generally those related that can be linked to alcohol. And if you want some specifics on it, the public health team here go into detail about the number of deaths that can be specifically attributed to alcohol, or can be related to, but not necessarily only caused by alcohol. If you look at those, they look at them per 100,000, so that they're compared to the UK rather than per 60,000. But there's around 13 alcohol-specific deaths per year in Guernsey, and about 30 alcohol-related deaths per 100,000 as a rate. It's higher in men than it is in women, which reflects the pattern of drinking that I referred to just now. So those are some of the high-level statistics that show really the rates, but also the harm that it can cause at that personal level.
And have we been seeing any changes in the trends over, like, say, the last 5-10 years? Like, what's going on there?
Yeah, the trends tend to bounce around a bit, to be honest, because our numbers are relatively small. So when you start to drill down in looking at trends, you have to realise that they go up and down a bit, really. And so it is quite hard to see trends. We've certainly seen the trend amongst males and females kind of split out, if you like. And so the most recent data show that the trends amongst females are kind of coming down, and men is staying quite high. So that is almost widening, which I think gives us a bit of a signal. In terms of disease trends, they're relatively stable, but there has been an uptick in the category of disease, which I think they call mental and behavioural causes. And those, what they really mean in that is dementia and Alzheimer's. Those are the two biggest factors in there. And we know that alcohol is a key cause of dementia. And so you can start to piece all these pieces of the puzzle together. And in terms of the levels of alcohol drinking, the trends are a bit easier to see because we have larger numbers. And we have seen some interesting shifts in the last wellbeing survey. So if you compare to 2013, 2018, and the last one in 2023, we have seen quite a jump in the number of people who don't drink at all. So we've seen a jump in abstinence. Now I'm trying to remember the exact statistic.
I think it was 16. We've gone up to 16% of people not drinking now, and I think that's gone up. That's gone up from 9%, which was sort of several years ago. But that's a really positive, move for us, and I think we're sort of seeing, speaking generally, young people, sort of the age of under 30s now. We sort of definitely see a trend to say that they're thinking about their health a lot more. And by doing that, they seem to be reducing or abstaining from alcohol completely.
It's quite interesting when you look at the patterns of some of the graphs, because you see this almost waterfall effect where you see more people abstaining, but that's obviously coming from the previous groups who were drinking to some level. And so you're seeing this reduction in the severity, if you like, or the extent of drinking. And as Andrea says, the young people seem to be drinking less frequently. We're still seeing a bit of a signal on binge drinking, though, with young people and amongst men. And so that seems to be an issue. And the definition of binge drinking is 5 or more drinks in a single occasion. And that's the kind of allows comparison to other factors as well.
And how does this underlying data then feed into the work that you guys are doing at the Commission?
Well, we have a combined substance use strategy, which has been going for the last 5 years, and this is coming to the end. So this is next year will be our final year of this 5-year cycle. And we look at all this data and we try where we can to have public awareness campaigns that we can sort of get to the general public. And that's one of the reasons why we're here to talk about the Count 14 campaign, which we've been doing for the length of the strategy. And it's all about informing the community about how many units are in a drink, how many units can be drunk per week. So at the moment we've got a sort of a campaign that we go 6 or 7. So within that, 14 units per week spread across 3 or more days. But within that, it's sort of an easy way of remembering is 6 pints of lager or beer, 6 glasses of a medium-sized glass of wine, or 7 double shots. Now, those all add up to 14 units. So it's quite a good way of people remembering that over a week, 6 or 7 of their drink of choice, and that will form the 14 units.
Do you think, because talking units, I find units quite abstract. So it sounds like this is a much better way of getting the message out to the public.
Yes, I mean this message comes from the UK and the Chief Medical Officer, and we've taken this actually from Scotland originally. Scotland came out with the Count 14 campaign, and we worked very closely with them and used, we were able to use their resources, and we probably found that this is sort of the simplest way we can get the message across. And as you say, it is very difficult. But more drinks now are being labelled. So if you look at a bottle of wine, for instance, it will actually tell you how many units are in that bottle of wine. And another easy way of remembering that a bottle of wine has roughly 10 units in it. And so, a bottle and a bit to add to your 14 units per week, it's quite an easy way to remember.
And do you see, how long have you been running the campaign for?
So we started this at the beginning of our strategy. Yeah. And in the first couple of years, we did a survey that went out sort of via social media, and we got a really good response. Unfortunately, it showed us that very few people know what units are, and actually, we did the survey again after a 2-year period, and we did find that the community didn't know that the units had changed to being the same for both men and women, and we saw a marked increase there of the knowledge that we were sort of giving. They used to be very different, but now it's 14 units across the board for both male and females. And so we have seen an improvement in the community knowing about units and about the Count 14 campaign. We've got a bus that goes around, and we've got the Count 14 on the back of the bus, and where we can with social media again being so prevalent now, getting the message through various means, and it's really exciting. We are seeing much more of a community uptake of our message.
Where would you like to take that as well? Is there any way that you can build on the success of that campaign?
Yeah, well, we're starting sort of. We've just launched. Actually, we've just had our first sober supper club, which was 3 weeks ago now, and we found it quite sort of difficult at the level to pitch it. But basically, we wanted to give the community an event that they could come to, that they could meet other like-minded people, and it would be alcohol-free. So the whole event itself, we had canapes, and we had Kooky Lifestyle who came, and Joni has got a vast array of beautiful alcohol-free drinks, and so we had a taster session there. So the group that we had were able to have a lovely evening tasting sort of new drinks that perhaps they hadn't sort of, tried before. The pubs and clubs now are getting very much better at using non-alcoholic, having non-alcoholic drinks now. And again, I think that's another area that we really want to sort of try and encourage, people. And again, we're not necessarily talking about people stopping drinking completely. Everyone has a choice, but we really would like to sort of see perhaps alternatives. So having an alcohol-free drink in between having, an alcohol drink, and so just trying to reduce the amount that is being drunk per session and per week.
And I guess an important message as we come into the Christmas period as well.
Yes, yeah. I mean, I think we want everybody to enjoy themselves. And I think that's the interesting sort of thing that as we've been doing sort of this, and I've been doing this for a very long time now, sort of alcohol is everywhere. We use it for every occasion, whether it be celebration, whether it be to commiserate, sort of that we can always find a reason why we feel that we need to drink, and I think that's why it makes our job extremely difficult. It's very normal now, sort of in Guernsey. Alcohol is really normalised, and it would be really, we've done so well with smoking in Guernsey. Now we're into a single figure as far as smoking is concerned. And it's really very much the hard to reach and those that, really find an issue with it. And it would be amazing if the community could take that sort of attitude towards alcohol, because we are a long way from that. I don't know, sort of, Simon.
Yeah, I mean, the way I think we look at it is with this, always with the Commission, we're looking at how we use the evidence to inform the behaviour change, and then using what we can from behavioural science to figure out, well, what do people need to restructure their behaviour? And of course, you've got the individual level, and there are loads of tips and tricks. So at the individual level, there are apps that people can use. Now, for example, the Try Dry app, which is linked to the Dry January campaign, but you can use it all year round. And it's just a monitoring app, a very simple thing where, it's a nice simple platform to say, what did I drink? How large was the drink? How many did I have? And it will convert that into units, and it will give you that piece of feedback. And we know from research that behavioural monitoring does help people to understand their behaviour. So those kinds of things can be used on the individual level. But also there are tricks around, for example, using low or no alcohol alternatives to break up your drinking throughout the week, for example, or even at the smaller level to try having that non-alcoholic drink first. Because we're so, as Andrea said, alcohol is so normalised, and it becomes habitual, and there's a ritual to alcohol. Often there's a ritual of a set of behavioural patterns that come with it. So it's either going to the fridge and getting out a bottle that feels cold in your hand, opening it and listening to the sound of that, getting the glass out, pouring a glass of wine, or whatever it might be, or the same with opening a can of beer. But if that is a non-alcoholic version of the same thing, such as a non-alcoholic beer, a lot of that ritual, which underpins the behavioural habit, is completed, but you haven't got the negative of the alcohol, and so that can sometimes delay, or in some cases kind of prevent people from saying, well, I feel like I've had that ritual of, I don't know, Friday night or something, and opening a beer when I come home from work. And if you are in that pattern, which let's be honest, many people are, having that, switching into that non-alcoholic thing can almost disrupt that habit.
And
so
also
it's using those kind of tips and tricks.
Yeah.
Sure.
Also having, the drinks in a nice glass or in the same glass as you are with your mates, sort of, and so it might be like a disguise, if you like. But then if you've got a nice goblet, or you've got a nice, glass that you've got a non-alcoholic drink in, nobody knows, So it's very easy to feel part of your group doing exactly the same thing, but you just have the alcohol-free version.
And one thing we've seen pick up is that there was a call when people were starting to experience non-alcoholic drinks and non-alcoholic beers especially, and there was this real difference of saying, you could, if you were drinking an alcoholic beer, you could go to the bar and have something out of draft and with a tap and and all the rest of it, which feels like your ritual, but you couldn't really do that with non-alcoholic beers, but you can now. And so there is whilst alcohol is still exceptionally heavily normalized, culturalized, accepted, and that's going to be a big ship to turn around. We can chip away with these elements of normalizing non-alcoholic drinks. And so if you are, not drinking in that social setting, such as a pub, you can still have the pint in your hand in the same way that you would previously. And if that is something we have to remember from a behavior change perspective, you have to start where people are. We can't start where we'd ideally want people to be, where everybody is drinking less than 14 units, because goodness, we know most people don't. We know the statistics show us that. So you do have to start where people are and start restructuring the environment in which our behavior happens, and that goes all the way from the individual level stuff that the Commission is responsible for, all the way up to those commercial determinants of health and regulation.
You touch on those commercial sort of elements here as well. And it looks like the substance misuse strategy, there are some elements within that which we haven't seen come in, which we were expecting. So and we've spoken before, minimum unit pricing and levers like that. Is that something that should be thrust back into the spotlight and progress made on, and why?
Yeah, I mean, the regulatory parts are really important because they help structure a healthier environment. And so we need to remember that our behavior we're highly, cueable individuals, and humans, generally respond to the situation around us. So we respond to advertising, we respond to price, we respond to availability and sponsorship. Even with the best will in the world, we try to think that we're not influenced by those things. And we always like to think we're highly in control and making conscious decisions about everything that we do. But we do know, I think, when we look a bit harder, that that's not the case. And that's the case for everything that we do, whether you talk about physical activity, whether you talk about what you choose to eat, what you choose to drink, everything is cued by our environment. And so the substance use strategy has a good focus on policy and regulation. Now, those matters are for the states to decide. And so they have to put those in the big machine that decides which policies get prioritized and why or why not. We help with evidence. And if you look at Scotland, there's strong evidence that minimum unit pricing has reduced drinking levels there with no impact on the retailer, actually. And so there was a big pushback initially because of the perceived impact on retailers. But if we're truly going to solve the things that are costing government money in the long term, which is about the facts we talked about earlier, those preventable deaths, the years of life lost to work and to families due to alcohol, then that regulation is really important and a really important part to set the context. And it makes then our job easier as the Commission, who tend to work in the community, on the community side. That makes it a lot easier, because if we're trying to encourage people to adopt different behaviours and the environment enables them to do that, then the two work in synergy. But of course, you could see that the two would block each other if they're not working together.
Well, I guess that leads quite nicely into where should we be going? So give it a 5-year lens. Like, what would your ideal scenario be? And I guess having that strategy up for renewal is a kind of opportune moment for this as well.
Yeah, well, we hope that every area, our risky drinkers go down into our moderate drinkers, and everyone goes down a level so that we have more abstaining, we have more in the low risk category, and I suppose that, you know, for us, if at the next survey that is showing, then that's some way to the success of the strategy. You know, we have a lot of our funding is taken by our commission services, and that's a really important role that we have in the community, that we have independence, we have Action for Children for the younger people. And, you know, that it's all very well. We really concentrate where we can on prevention. But for those who we can't prevent and have, you know, come into some sort of area that they really do need support and help, then the commission services are amazing. And they will not only for the individual themselves that are suffering through using alcohol in a disruptive way, but also for the families, for loved ones, and for concerned others that can see, you know, sort of we want to try and get into the workforce far more than we have done at the moment. It's a real area that we would like to progress and think about alcohol in the workplace, and you know, sort of and also, you know, the States of Guernsey is a huge area that you know have many workers, and look at sort of the policies around that, and looking at all the different areas of the community and trying to encourage them to be a role model, if you like, and have alternatives to always having parties with alcohol or events with alcohol. And we can hopefully sort of see the progression through the next strategy.
It's interesting. I think that the approach that is taken in the substance use strategy, which is obviously led by public health, but we have input to it, is a really good one. Mm-hmm. You know, they take what's known as a whole system approach, where so if we dialed back 20 or 30 years, health promotion would have been the approach, and it would have only been about that promotional piece. But as we've just spoken about, it's that whole system. So it goes all the way from primary prevention, which is also looking at what we call the wider determinants of health. So we're looking at, you know, these things need to line in with poverty, with housing, with employment, education, because those are the things that then determine health inequalities, and therefore those who will effectively come out worse, even for lower amounts of drinking. So there's something called the alcohol harm paradox, where we find that individuals who have greater social deprivation, even though they might drink less than those who don't, the harm is greater because it often interacts with other things in their life, which together creates a more kind of a greater health inequality. And so I think that the states in general and government and public health have understood the need for prevention. But what prevention really means is that mix of the individual and the societal and all these wider and commercial determinants. We've got to get that mix right, because if you only focus on one part, would be to miss the point. And we're seeing that come through. We've seen many more of our politicians be really supportive around prevention. We've done a lot of work about prevention, as you know, conference about prevention, public health have been talking about it a lot. We're writing it in many different ways and telling people about it. And it's been understood. And it's now understanding really what that prevention is. If we're really interested in a sustainable health and care model, if we're interested in sustainable economics in Guernsey, then we need to take that long-term view that puts the prevention in place now. And a simple phrase I use is, if nothing changes, nothing changes. So we do need to look at the leadership. You know, Andrea mentioned there, the leadership within different organisations. If you're, you know, a business leader, do all of your occasions have to be around alcohol? What's that, you know, doing to your employees? What's that doing to your bottom line? What's that doing to your recruitment and retention in terms of, you know, we see young people switching towards a healthier view of life now. Is that something they really want now? Or is it inclusive if people don't really want that kind of boozy Christmas party, or they want an alternative to it? And using those things to not be seen as the fun police and those people who are trying to reduce people's enjoyment of life, but actually just taking a slightly more contemporary view of things, and saying, look, let's, you know, there's all sorts of opportunities to drink alcohol in the world. Does it have to be at work? and those kind of, or does it have to be at work dues, for example? So there's all sorts of ways that we can look. But that whole system approach relies on everybody doing their bit. And if they change, the system eventually changes. But system change doesn't come from a single point.
And just wrapping this up, if there's a few places you can signpost people to where they can find useful advice, where would that be?
Well, as I mentioned, we have Independence, which is our adult service, and they have an excellent counselling service, which is all free and confidential. So you can go online and if you just sort of Google Independence Guernsey, it'll be the first thing that comes up. And you can talk to them by phone. Action for Children is there for 12-year-olds right the way up through to 25, and they're located at the bottom of Victoria Road now, and Independence is in Mill Street. So again, very accessible, and they are both there for not only for the individual, as I said, but for loved ones and concerned others, and it need be only a phone call or a text message or whatever, that they will get support if they want. They can go to their GP, and then the GP, if dependent on the severity of their distress, or they can then be referred to the community drug and alcohol team, and they are the clinical sort of side of it. So they may be given an alternative to medicine, sort of some kind of intervention that will support the individual.
That's brilliant. Andrea, Simon, thanks for your time.
Thank you.
Thank you.
Yes. Thank you for tuning into this podcast. If you've got all this way, I'm really hoping that you've enjoyed our work. There's a few things you can do, though, to support us. Follow, like, subscribe, share, whatever you can do to help spread the word of The Quarry. The other thing you can do is head on over to our website, where you can become a member and really support independent local news.